So good morning, ladies and gentlemen, and we're about to start. So we have a significant number of people online, thankfully, and it's my pleasure to welcome you to the Global Health Connectors' second day at the Science Summit, which today, as you can see from the slides, is about the power of convergence enabling prevention and management of obesity and related NCDs. This is, in fact, our third year at the Science Summit, and yesterday we had a full day on women's health for those of you who attended. And in previous years, we've had a focus, in addition on women's health, to data and digital. So today's focus, though, is, as I said, about convergence, and I'll explain a little bit more about that. I'd like to thank all of the sponsors, in particular Novo Nordisk, for making today happen, and to all of our panelists and to health, and as well as our strategic partners, and I'll come back to that a little later. So in terms of housekeeping, we are not expecting any alarms or fire drills, so there's nothing to announce on that score. We, in terms of the format for this day, have decided that we will use minimal amounts of slides. This is in order to allow participation from the audience, because many of you are as knowledgeable as some of our panelists, and we want to engage in active discussion and participation between the audience and the panelists, and also allow the audience to understand who are the other panelists to facilitate greater networking between you. So for the panelists who are in the room, please remember that we're looking for short interventions today, not long speeches, in order to facilitate that active participation. So a little bit about who we are. So this is our first week of trading under our new name, the Global Health Connector. Some of you may know us as formerly the ECH Alliance. And I'm going to, in a few short introductory slides, explain 3 Ws. So who we are, what we do, and why you should work with us, hopefully. So, next thing, we believe that innovation is siloed, that health systems are disconnected. And what this slide is showing, if the pandemic taught us nothing else, it's that health doesn't stop at borders. So we are very much about healthcare crossing borders, innovation crossing borders. So we believe that the world needs an independent, global, trusted connector to drive change across the economy, finance, health, and science. And ultimately, that's what we do. So, looking at what we're not, okay? We are not a charity. We are not a lobbyist. We are not a trade association. We are not a vendor. We are an independent global platform that connects everyone to tackle health, well-being, and longevity. Perhaps this is one of the most important slides. We have spent 15 years building an infrastructure to actually facilitate the transformation of healthcare. And on this slide, you see our 3 principal assets. So we have a connector program that curates global engagement. We have our ecosystems, and I'll say a little bit more about those in another couple of slides, which is our local intelligence real-world impact vehicle. And then we have our strategic services that create tools that drive influence and action. Our thematic focus at the UN has been, in the last few years, women's health, health data and digital, healthy aging, and cancer. For those of you interested in statistics, this is what we look like in terms of the number of countries that we operate in, the 90-plus ecosystems, or communities, as we sometimes call them, and our reach in terms of our world population and the number of meetings that are organized through our ecosystem network. And this slide is very much to the right. This is what our ecosystems look like. These are all of the stakeholders that you need to transform health and care. So we spend considerable time building those ecosystems, creating the relationships, breaking down the silos, creating trust. And the key to this is our public sector members and our strategic partners. And this is then about transforming lives. So here's what the network looks like today. So it's everything from Argentina to Australia, from Land's End to Timbuktu, from Singapore to Sao Paulo. And I'm not going to go through all of the individual countries, but there is considerable difference between how health systems use them. So in Spain, for example, we have a considerable number of ecosystems, which represents the fact that regional authorities in Spain is much less central how they organize their healthcare systems. In Finland, which has a tiny population, the Ministry of Health were very keen that we had a considerable number of ecosystems relative to their population in order to drive innovation. But then accelerating these silos, on the left-hand side, you see all of the stakeholders that we will connect and bring together. And arguably the most important one being people and communities, because ultimately this is what we're about. We are trying to transform lives. But what this is also about is that we do not talk about collaboration, we deliver it. We have the trust, the credibility, the neutrality to bridge the gaps that others cannot. We call this collaboration. So yesterday we used the word for the first time in the audience, and Richard tells me that another 5 people immediately said they were going to steal it with pride and adopt it. But for us, it's very real. So convergence, which is what the next panel is going to be talking about, is this idea I already mentioned about connecting the economy, finance, health, and science. 4 areas that we believe are too often silos, and we need to facilitate greater collaboration, and whether that's at a regional, national, or international level. So this is about integrated solutions, which is going to come up in the panels later today. But a bit about our strategic partners. So today we are lucky to have people from GSMA, the Global Trade Association for Telecommunications. And some of you might think, well, what's that got to do with health? And the whole point is that digital health will only take off if the connectivity is assured and is reliable. So in Africa, in parts of India and rural communities, this is absolutely key. We have Health AI, which is the responsible government NGO that is trying to develop responsible AI development and governance. And Unite, which is a parliamentary organization where a number of speakers will come from today, and that's about giving us expertise in the policy arena. And then we have Health, which is we believe is one of the best health conferences in the world, where we have a dynamic destination for collaboration. And then we have McKinsey's Health Institute, where we have 2 moderators from today, who will be bringing the expertise and know-how and research that MHI has. A little bit about some of our activities, and I'm not going to talk in any detail, but just to explain that we have various tools that we use. So roundtables, and you'll see a little bit more about that on a few slides. And then forums where we're building connections between pharma companies around digital health, around hospitals where we're trying to drive collaboration between them. Our Insight Hub, our pitch days where at Health Europe, for example, we had 14 startups in digital health pitching at our event in Amsterdam. And also conference and events, and I'll say a little bit more about that in a second. So that's an idea of the activities. And then some of the services then that we provide, some to only strategic partners, others to our public sector members. So everything from consulting services like market entry, matchmaking organizations, talent recruitment, bid management for projects, strategy reviews, and infrastructure delivery. But the importance of saying a little bit about the services that we have is all to do with the fact that services and our activities is what generates revenue for us. And the revenue is critical for us to be able to do more and to drive our collaboration action type activities. So this is an example of the roundtable reports, which we've been running for, this will be our 6th year, and we've been sponsored each year by Johnson & Johnson, Microsoft, MSD, and IQVIA. And this has been about the development of the European health data space, as well as specific topics around AI and vaccination IT systems across Europe initially, then the rest of the world. So that's published reports, it's virtual, and we have about 40 different stakeholders at each one talking about and investigating and deep diving into the situations. So it provides substantial know-how. And then we have our work as projects, and I'm not going to particularly talk about these very long. Here's a list of the projects that we do, and I'm just listing them by topic. So we have digital health and data policies, support tools, and then skills for the health workforce, and then smart, healthy living. And we've got a couple of people in the room who are project partners with us, so there are people you can talk to if you want to know more detail. In terms of what we actually do, what are our activities, you can see again in terms of influencing, transformation, amplifying, but it's about strategic partnerships, which are about invitation only to fight for better health, equity, and systems that serve the people better. Very quickly, this is our flagship program of all of the events that we are involved in around the world. And two of the audience have just come back from Mumbai, where Health Parliament has been a very successful event driving some of the digital health content. And you can see that we're quite busy around the world. But then I'm just going to leave that there for a second. So that's the QR codes if you're interested in seeing some of our newsletters and getting involved in our Connector program. And then finally, wrapping up for the, if you like, the introduction, we encourage you to talk to us. There are a number of people in the team in the room. If you want to know more and you're interested in what we do and you want to get involved, please speak to us. We're open for business, as the slide says. We're open for partnerships, and we're open for impact. Without being too apologetic, we're no longer shy. We are prepared to talk about what we've built. We're proud of what we built, and we need to grow, and we need your help to grow. So with that, I'm going to hand over to Richard, and we're going to switch up about what we were planning to do. So thank you.
Thanks, Bleddyn. Right. Good morning. This is going to be speed dating for collaboration, okay? So when we renamed the organisation to Global Health Connector, we also looked at our vision and values, and our vision is to connect brilliant minds across the world to transform and accelerate global health, well-being and longevity. We've got some brilliant minds in the room, so we're going to do a 5-minute unconference, if you're familiar with this idea. So no agenda, no speakers, a broad subject, and want super, super quick responses, 15-second, 30-second answers if we can. This really plays to our value of dynamic collaboration, which is we want to get in a speedboat and out of a rowboat. So we're going to go a lot faster and help things move along a lot more quickly. This is collaboration in action, okay? So I have a suggested topic, and what I'd like is super quick fire answers to this question, which was a thought that came up yesterday, which is this. What doesn't need to be invented but just needs to be implemented? Okay, plenty of things already exist, plenty of things already the work has been done, but they're not implemented. So I'm going to open up to the floor for 5 minutes only, rapid fire. What's already been invented that doesn't need to be implemented? And I'm going to hand over to the floor. And if anybody can respond to if anybody wants to suggest something, and then I'm going to open it to the floor to just make super quick responses. So this is dynamic collaboration, okay? Can anybody think of anything? Anything that's been invented that doesn't just need to be implemented? With EHR everywhere. Anybody want to respond to that? Anybody got a reason why that's not been implemented? Cross-country collaboration. Yeah, they're working in silos. Okay. Anything else? Anybody got anything else?
So the EHR challenge would be interoperability, which we do quite a lot about, but the point that is being made is very well made. So come on, shy and retiring audience. Who wants to dive in? This is your chance.
There's no incentive for vendors to make this work better for communities.
No incentive for
The software vendors, whoever creates the technology to make this better for communities.
Okay, thank you. Anybody have a response to that? Anybody got another one to contribute? Yes? Go for it.
I would say I definitely agree with that. There's no incentive for people to invest. And also there's varying degrees of technology and levels of technology that may or may not work together at this point in time.
Okay, anybody else?
Yeah, some more.
There we go. The gentleman from Bath, I do declare.
I'd probably say it's less that there's no incentives. If you make software too interoperable, you actually make it easier for people to move away from your software. So it's almost a perversive incentive not to make things interoperable.
Interesting. Okay.
But that's where the open EHR and open source software is pushed. So,
Yes, sir. AI algorithms that capture disparity? Okay.
or create bias, right?
Yes, lady at the front.
There's a lack of democratization, meaning that if you're somewhere in a zip code where you have access to a health center that has a good system in terms of EHR, maybe you're in the system. But if you're not, you're really struggling to get into the system, and therefore it's not just about engagement, but your healthcare needs are kind of not visible.
Does anybody have a response to that?
I mean, these are all things that you can talk about if you're more comfortable one-to-one in the networking sessions. But the idea about this unconference, and we're just testing this, is that we really want to get to the stage when, in a larger audience, we actually start to really engage in discussions between the audience and the panelists, and try and actually move from identifying known challenges to what are the solutions? How do we make a difference? So we got, anyone else want to?
Got time for two more.
While you're thinking about it, some of the things that were said yesterday that interested us was the Swiss constitution that says the strength of people is measured by the well-being of its people, which I'd never heard before. We had the usual discussions about slow down to go fast. If you want to go fast, go alone. If you want to go far, go together. We had a very interesting concept of intergenerational knowledge transfer. So people who had been working in healthcare for 40 years knew certain things that the younger generations did not know because the knowledge wasn't being shared. And we had some interesting points about change, where there was people advocating for radical action, stories before statistics, and women as activists. one of the things that we're interested in is the whole idea of the woman as the caregiver for the family, so that if a woman is ill, it doesn't just impact the woman, it impacts the health of the spouse and the children, and not enough is actually understood about that particular aspect. But anybody else want to dive in and raise something? Yeah. I'll give you this one.
I was thinking about the first comment from our friends from Switzerland there, and I am curious, as we think about EHR and expansion, do EHRs actually capture the information that is actually necessary to be meaningful? I mean, even the topic we're going to pick today, which is obesity, I mean, yes, it'll capture your cardiometabolic information, but does it capture quality of life impacts, social impacts, et cetera? So maybe some content missing from EHRs before we can talk about expanding it even further.
In some countries, the EHR will be synonymous with hospital record, not the primary care record, let alone the social care record, where there's more likely to be the sort of content I think that you're alluding to. So yeah, very good point.
That's us.
We're done.
We're done.
Oh, sorry, one over here. So there's behind the pillar.
Sorry, I'm hiding over here. And I think building upon what you just said, who is determining those endpoints of what should be recorded in those EHRs? There are things that matter to clinicians, but also what matters to the people that are using those records, and how are they going to implement that in their day-to-day life, and how are we setting them up for success to use that knowledge to then create a healthier lifestyle? And then things come in to play like health literacy and things like that. How are we making those EHRs easier to not only access, but then also comprehend the information and then make it actionable for the users?
So let's do a quick test. Yeah, let's do a quick test. Put your hand up if you have seen your EHR. 1, 2, 3, 4, 5, 6, 7, 8, 9. Okay, so it's still under half, if you think about it. And that's part of the issue. So if you don't know what's in your EHR, it's a bit irrational that you fear what's in there, or that actually it's useful because it's not useful to you. Okay, thank you very much.